Hello, everyone. Thank you for tuning in. We have here with us Dr. Chris Tsai, which is an expert in chiropractic work, right? I'm just going to have you, Chris, just introduce yourself, let our guests know who you are, what you've been doing, and we'll just go from there.
Sure. My name is Chris Tsai. I'm actually a chiropractor. I'm actually a sports chiropractor. I've been in the field for about 24 years. Been doing sports medicine since I was in high school, so that's back in 1993. So I've been doing a lot of different musculoskeletal stuff, as well as some autoimmune stuff. Been in the field doing different things at a different time. I was in Taiwan for 10 years. I came back and got my sports diplomate, which is in a way pretty much more of a geared towards just more sports medicine, and we do a lot of sideline chiropractic work. So every single NFL team now have a chiropractor on site. Right now is Olympics. Actually, Team USA has got a huge group of. I have a lot of my colleagues actually that's working with Team USA right now. FICS, which is the more of a global sports chiropractic group. We actually also got a group that's in the Olympic villages that all Olympians have access to them. So anybody who's a Olympian, doesn't matter what country you're from, they actually have access to a sports chiropractor. These sports chiropractors have to be vetted for. So basically, like me, I have a sports diplomate, but there's also actually international sports chiropractic certificate you could actually obtain to actually work in these events. So basically, the only difference between us and the average chiropractors is we're nerds. We went to school a little bit more, and then we actually putting a little bit more hours to do more on-site stuff. Because on-site it's more than just working on low back pains, working on things that actually happen. We're actually on site on when things actually do get it, and then you get injuries. So we have to do a little bit more than just manage care. We have to do emergency care, as well as we have to look at, can this Olympian or an athlete continue to compete at that event. So a little bit about me and what I've been doing for a minute. I have 3 clinics. One in Burbank, one in Arcadia, and one in West Hollywood. We like to call West Hollywood location Beverly Hills, just because it sounds a little bit more bougie. But no, it's right, and it's right in the middle of it.
You can go back and forth.
We could go back and forth.
So now you have 4 locations, right?
Exactly.
Beverly Hills and West Hollywood.
Exactly. We're DNA Sports Medicine, which is also part of DNA Sports Academy, located in Chatsworth, where it's a junior high school program where athletes can go to get trained. And then so the idea is to start them at a junior high level, so when they go to the high school level, they could compete to go into the better private schools and try to get a little bit more scholarships. So we're part of a bigger picture.
Interesting.
It's a good field. I have experience with you as far as like chiropractic works, and my dad used to come to you.
Yes.
And one of the things with my dad, when he used to go back to him, he used to like swear on his work, to other people. He used to like tell everybody,
Great guy.
Yeah. When he used to walk in his office, he used to come out like running, So that's one of the things that I've experienced with you in that sense. And I know we had a lot of questions for him. He had a lot of questions for him. I think maybe.
I'm the question guy.
Yeah, he's a question guy. So, what is it that, as far as what does chiropractics are different? Let's say, what I always, what people usually confuse is between like massage and chiropractic, right? What is the differentiation between those two areas,
Basically, chiropractic came from D.D. Palmer, and he basically believes that the disease comes from the dysfunction in the nervous system. All right, MD's allopathic. It's more of an outside in. You know, if you have a bad liver, we take it out. If you have a cold, we get rid of the symptoms. But with chiropractor, we believe in inside out. We believe in the innate intelligence and how it works with our body. We allow the body to basically heal itself. We don't claim to heal anything. We claim to help the body heal itself. So you just got to kind of figure out which way to go from that, and then we attack it that way. Massage therapists, they do a lot of muscle work. You know, they do now massage therapists, they do even more. So massage therapists actually break down to either massage, lymphatics, or they do fascia work. We do a little bit of that, but in order to actually do the full muscle work, you actually have to work about an hour to an hour and a half. Obviously, when you go see a chiropractor, we're more focused on adjusting. We're more looking at the joint health. Okay, you know, a lot of chiropractors say we want to adjust the bones. Okay, you can't adjust a bone, you'll break it. That's all you can do is break bones. We don't want to do that. We want to actually adjust the joints. Once the joints are actually functioning, then you increase the blood flow to the area, you decrease the nerve pressure, and you actually allow the body to heal itself. That's basically chiropractic in a nutshell. I'm really oversimplifying it because we could talk a whole hour about just chiropractic philosophy because there's a lot of different schools of it. That's the traditional way. Nowadays, everything we have to be scientifically based. So, like if you go see me, I'm not going to say this is a subluxation. That's the old school way, and and it does kind of exist, but then there's a lot of gray areas with it. Nowadays, everything has to be scientifically based. A lot of what we do, we want to have some kind of study to back it up. So if we're adjusting something, it's actually we're trying to alleviate nerve pressure. We're trying to basically decrease that area, pressure in that area, so that way the muscles could go back to function normally, the joints could go back to function normally, and the rest of them, the body will just heal itself. You know, if I cut you, you know, and we don't do anything with it, the body will heal it, and it's kind of what we're doing. But yeah, that's basically chiropractic in a nutshell.
Interesting. That's where my first question comes in. So I basically, I don't know if he's going to charge us for this or not, but go ahead and send us.
You'll receive the invoice in a little bit. You know? I charge by the minute, so
I'll make it quick.
This is a 30-second.
So in terms of chiropractic, in terms of joints that you mentioned, me personally, I do have about, from what I remember, from what my last chiropractor said, or whenever I did my MRI, they said I have about 7 dislocated discs or
disc herniations.
Disc herniation, yeah.
So basically, a disc herniation is so in between our spine, we have 32 segments in our spine.
Okay.
In between each segment, there's actually a little disc, kind of like, I like to call them like, you know, shock absorbers. Inside the shock absorber, there's actually a gel part. And then when we sit too much, we do stupid things, you know, like people that throw people off into the pool, or we drive a lot. In LA, we drive cars a lot. And the discs just get micro traumas, and eventually they kind of crack. And once they crack, this gel stuff actually leaks out. And when it leaks out, it puts pressure on the nerve root. And then you get the sciatic pains, you get the radicular pains, you get the muscle weakness, you get the numbness and tingling going down your arms and legs. That's what a disc bulge is, basically. Now, normal wear and tear, you will get about, at least 2 to 3 disc problems. But basically, these discs, what happens is once it's broken, it stays broken. So a lot of times, what the allopathic way they do is they go in and they clean it up and they seal it up, and you're good to go. But when they go in, they actually destroy a lot of the core muscles, and they destroy a lot. Now, there's some orthos and neuros that are a lot better at keeping it together now. But in a traditional way, they go in, they tend to destroy some stuff because you're putting 2 probes in there. Either way, you're going to have to destroy some tissues. That's how they fix it. chiropractically, we actually do something different. So the only reason why these discs actually bulge out is because poor biomechanics. If you look at our spine, there's actually the disc that's in the front, and there's two joints called the facets in the back. So it's kind of like a tripod. So if the tripod, any one part that's actually dysfunctional, it's going to put more pressure on the other parts. And so a lot of times what we do as chiropractors, make sure all the joints are actually moving, then you won't have this issue. But when we have poor postures, we know if you're in the competitive round, or if you're guys who like to be bodybuilders and weight lift, and then guys' egos are the best thing in the world. How much plates can you put on your squatting, and then they slip, and then the disc breaks, and then there you go. I make more money.
That's where
the bottom line.
That's where
always money.
From.
And so that the disc bulges out. And then so what we do is we actually restore those biomechanical dysfunctions and then allow the body try to heal itself. For instance, I have one lady that we actually just made a video of, obviously for HIPAA reasons, we can't say who, but she got in a car accident. She had a 5 mil disc bulge in her neck, and it was radiating down her both arms, and then she was losing, sensations, and she couldn't have a hard time gripping. And she didn't want surgery. So what we did was we did some chiropractic. We adjusted her. We actually had the ortho go in and did some PRP injections, which is the next generation of healing is regenerative therapy. She did some PRP injections. We adjusted her. Last time she went and got a MRI, the 5 mil actually become about 2 mil. And then she had another one on top that actually just disappeared. And now she's got full function of her arms. She's doing great. She's been doing great for about 4 or 5 years now, so she's very happy. That's what we do. We restore biomechanical dysfunctions. We strengthen the muscles around it, and then the body usually heals itself. Another example, recently I have a... She was one of my football players. She got injured. She had a 7 mil disc bulge in her low back, and she wasn't able to walk. She's literally crying all day. The doctor says, "You're done. No more sports, no more beach volleyball, no more football. You're just lucky to stay alive." So she came to see me. She actually flies from out of state to come see me, and we, threw everything we have at her. We actually, I use a class 4 laser. It's a Suma's class 4 laser that actually could what they call photobiomodulation, where it actually helps the body heal faster. And then that brings down the pressure, and then we also decompress the disc, and we also obviously adjust her, do some muscle work. And this year, she finally got back to the volleyball tour. And she just texted me today that she was actually chosen to be one of the 3 to go to China for Team USA. But due to poor funding, she cannot go. She just lost her job, so she can't go. Or she would have been going. And maybe in 2028, she might be on the beach volleyball in the Olympics. But that's... So we actually got her back on the field. We MRI her last week, I do believe, and I think the 7 mil has gone down to about 4 or 5 mil.
Wow.
So disc bulges,
So
they're no joke. Coming from my experience, they're no joke. I don't think mine is that severe. Mine should be less than 1, from what I know.
We both do bodybuilding.
I can tell.
Yeah. I mean, mine was the last time I checked, it was like 0.8 or something like that. Yeah, on a daily day basis, I'm having some kind of a hard time because sometimes I'll be in pain, but it's not as bad as you're describing or that you've seen from your own experience, right? But enough about me.
But that's the reason why we put him on a comfortable chair. Just make it more faithful, right?
Yeah, exactly. A little bit about yourself. What inspired you to become a chiropractor, you could say?
By accident, actually. So what school was that? Parker Chiropractic was sending me brochures and applications since I was a freshman in college. I was like, what the hell is chiropractic, man? What is this bunch of crazy cracks? I just threw it away. And then on my, I do believe, junior or sophomore year in college, I actually got in a really bad car accident. A Ford F450 kind of lost control. I was in Texas. Lost control, slammed into me. I flew over the ditch, slammed into the telephone pole. At that point, I was pretty badly messed up, and I was in hospital. And a month or two later, I was taking an exam, and I went to take my exam, and I blanked out. It was like, I've never seen this. I tell the professor, I think he gave me the wrong exam. I was like, oh, nope, 1410, right exam. So I first time in my life, before that, I basically, I have photographic memory, so test comes easy to me. First time in my life, I was like, what the heck? And I went to see a doctor, and they did all this test on me, and they said, oh, basically you lost your short-term memory. I'm like, well, I guess I could kiss med school out of there. And then one of my friends told me, oh, we should go see a chiropractor. I was like, Chiro who?
Chiro who?
And so she took me to a chiropractor, and he goes, yeah, we could kind of fix that, And so they started adjusting me. I goes, oh, yeah, I kind of like this. I'm a fifth generation traditional healer in Taiwan. So, we work with muscles and everything since I was a kid. I was like, this kind of like in my avenue. And it's also a doctor. Not an MD doctor, but still a doctor. It's kind of cool. So I told my dad's, oh, hell no, you ain't doing this. The traditional Chinese, Taiwanese. You got to, you could be a doctor, or it could be a accountant, or a lawyer.
Or a doctor again.
Or a doctor, And so I purposely kind of failed my MCAT and went to chiropractic school. And that's how I got into chiropractic. And once I got into chiropractic school, I found out there's more to chiropractic than just working on musculoskeletal. And that's kind of like got my blood going, and I feel my passion. And as I learned and I got into the field, I moved back to Taiwan. And in Taiwan, you're not just dealing with, you're not competing with the local chiropractors. You're competing with the local bone setters, the traditional healers, the MDs, the national health care. You're competing with everything. So I kind of have to find my niche. So my niche that time was working with autoimmune diseases. I was able to, you can't cure autoimmune diseases, but what we can do is we could actually suppress it to where they could actually live a normal life. So I work with a lot of people with lupus, with rheumatoid arthritis, with AS. Now, like I said, we're not trying to cure it. We're not curing anything.
Yeah.
But we could actually help them to where they live a more fulfilling life. And so that was my niche. And without the chiropractic program that I went through, I wouldn't be able to know how to do that. And so, a lot of credits to my mentor, Dr. Antonio Gonzalez, who passed away after 10 years after I graduated, so kind of bummed. But he kind of taught me everything I know about working with the body. So
now it's your time to become a mentor.
Now I'm mentoring a lot of kids. That's crazy.
There we go.
It's very,
that's
very
when you
crazy.
know you're old.
That's when you really know you're old. When you're like, people say, actually, this is my mentor. I'm like, oh. You just introduced me as your mentor. What?
No, I think it's a kind of an alternative because, you guys are doing, like you said, like alternative to surgery. A lot of times people are pushed into surgery.
Right.
That's like the quickest way because, of course, number one, there's more money for people referring it to surgeries. Like especially nowadays, it's all about medication. It's all about surgeries. First thing they do is whatever. It could be a simple thing. They'll be like, oh, go to surgery rather than alternatives, right? I think that's where you guys come in, is creating those alternatives.
Well, it doesn't matter which medicine we're practicing. It doesn't matter if you're MD, ND, DO, DC. It doesn't matter what kind of medicine you're practicing. We always tell people to start with the least invasive way and then work your way up. If the least invasive way is not working, then okay, then let's go do surgery. And then we'll do the next. But in the insurance world, we can only do what they're willing to pay and bill. And so for doctors, unfortunately, they pay surgeries, so we get more surgeries.
Yeah.
That's the unfortunate.
So that's the unfortunate part. But no, a lot of doctors are actually leaning towards non-surgical, which is great. Sucks for us because now there's more people in the pool, but it's great for the community. But yes, chiropractor. If I was making the universal medicine, I would say chiropractors and general practitioners should be the first line. Let's go to these people. The general practitioner and chiropractors, we're basically the same level of education. We could tell, okay, you need to go see this for more specific, or we could actually try this before you go there. I work with a lot of physical therapists. I actually have a physical therapist on site in my LA location. I work with a lot of orthos. I work with a lot of neuros. We work with each other because we try to get people to start with the least invasive, which is basically adjustments, muscle work, exercise, rehab, muscle strengthening. If that don't work, then we'll start with the next part. Okay, we start with cortisone shots, Prolo, PRP, which is the regenerative therapy, and work our way up. If that don't work, then that's okay. Then let's look at surgery. Last year, I have a kid with a labral tear in his hip. I was like, because he's trying to go to the next level, trying to get into a better D1 school. I was like, look, he's got a really bad labral tear. We've been doing, basic rehab and basic things. It's not working because he's just putting too much pressure on it. We actually sent him to surgery. But it's the best way to do to fix our body is always start with the least invasive. If that don't work, then let's go surgery instead of just jump straight into surgery. And that's where chiropractors are a very good field to start off with for any injuries that you have. Not gonna lie, we all seen the joint, and they're a great place if you have no major issues. If you want to do wellness care, you want to do just get a quick crack and go, great. But if you actually have any underlying diseases or if you have underlying issues, it's always better to go to a chiropractor who actually does an actual exam. In my clinic, we actually have an in-house x-ray, so that way we can see what's going on inside, as well as we do a full ortho or neuro to see what's going on with you. And then let's go and figure out a treatment plan for you. And then we analyze by visits of 10. Every 10 visits, we'll look at what's going on. And if you're not getting better, then we'll refer you out to see other practitioners. The reason why people like to go see a sports chiropractor, especially with a sports diploma, is we require more. I'm also on the diploma testing board, so we do write the exams and we do test new diplomas that's coming out. We want to make sure that what they're doing is they want to diagnose first before just going straight to adjustment. Adjusting's fun, don't get me wrong. I love to hear all the cracks. I love to hear, I like to freak people out, and it's all fun. But we got to know what we're fixing before we go and fix it.
Yeah, of course. If it's not broken, don't fix it, right?
Yeah, and if it's not broken, then you break it so you can fix it so you make the money.
It's like, what is this crack?
So, no, and that's kind of like what we try to do as chiropractic professions. That's why I teach my interns. You want to diagnose, you want to know what's wrong with it first, then we could fix it.
Do you guys do a lot of oops?
I like to do a lot of oops just so, freaks the patients out. And then, no, I was told I'm not allowed to say oops. Or I'm not Tsai really. I pull up the x-ray and go, I'm not allowed to do that either.
You know about x-rays, right? When I first told my dad, I said, hey, listen, there's this guy that I know that does chiropractic work. He's really great. Everybody's going to him and stuff. And he didn't really believe in that, right? So he was like, oh, I don't know. Because he went to a few and they hurt him even worse. Like he used to go to them and he couldn't even walk for a week after that. He's like, wait a minute, I had pain. Now I have more pain, and I cannot walk still, right? And he went and he had his x-rays of his like spine. And then I'm like, Dad, why don't you just show it to him? He's like, no, I'm not going to show it to him. So he was like testing what he's going to say. So of course he like he does this rock thing, right? You guys still do that?
Yeah.
So he does this thing, and you know, and he went and he told my dad, okay, there's the disc, whatever, 8, 9, 5, whatever it was. And then he's like, my dad's like, okay, you know what you're doing.
You passed the test.
Yeah. So because he didn't do the scan, and then he find out which exact problem and where exactly and how much it is and so on and so forth. And that's how he trusts. That's one of the things that how, you know, kind of discovered those. It was just
People are
funny
crazy,
stuff.
man.
Yeah.
They like to throw tests at you all the
Yeah,
time.
because
We're
you
all
know,
getting
like,
there, but slowly.
yeah, because
I'm
people
almost
don't
there.
trust. You know, like a lot of times you go to some places, you know, and they just do the minimal things to get you out, you know, or to do things. And you know, obviously, people don't like hate doctors, right? When you have a doctor in front of you, people hate. Like I hate going to a doctor. I haven't visited a doctor.
Who doesn't?
Yeah, I just hate it.
It's
Even
not
dentists.
an enjoyable place to visit.
Yeah, you know, I'm doing like an implant, and they did it, and it took like 5 months to put it again. And now I have to go back in to have the whole thing again. They did surgery, so every time they give me an appointment, I'm like, it's like almost like prison. You want to get out of it. You know?
Yeah, well, I understand. That's why I don't wear the white jacket. I don't wear scrubs. I wear t-shirts and shorts.
Yeah.
To make sure all your clients, all your customers are comfortable.
Make sure they're comfortable and they're not coming to a clinic. Yeah, so basically, when we're doing blood pressure and your blood pressure's too high, we actually goes, no, chill out, relax, you know, have some water, calm down a little bit, and we'll take your blood pressure again. Because a lot of times when you put those BP cups on, people just start freaking out. So we'll let them calm down and relax a little bit. Or if it's like super hot outside and they come in rushing in, especially in my area, there's parking sometimes. If there's a game going on and they have a bar next door and they park too many places, then you know they could come further out. We'll let them calm down, and chill out, relax. You know, I always joke around with them. We have a very, very laid back clinic. And we joke around with them and then let them calm down. Then we'll take the blood pressure again. That way we get a better read.
Yeah, it's more accurate.
Or we'll actually take both arms. So that way we see if there's any pressure difference also.
Oh, so each arm could be different.
Yes, there's a certain amount of differentiation between both sides because this side's closer to the heart. So it's going to be a little bit higher. This side's away from the heart. So it's a bit better.
But that they usually do the left, right?
Left.
Yeah.
They do on the right. So
They do on the right.
They
Usually.
usually do on the
like
right?
to do on the right, so that way it's not so high.
Oh, interesting.
But then normally we would like to do both. But
You mentioned about something like cracking,
yes.
right? Is it a misconception whenever they say when you crack your fingers? I know in the Armenian community, when they say when you crack your fingers too much, you're gonna grow up and be old, shaky hands and all that. Is that a...
Oh, I thought that's only in Taiwan.
So you guys have the same thing.
Oh yeah, it's like if you crack your knuckles, you're gonna have arthritis.
Yeah.
exactly.
Yeah, I think every culture has it. They're actually, you know, what technology, the cool part about it is we could study everything.
Yeah.
So they actually crack knuckles and they crack joints and they put it under MRIs and see what actually happens inside joints. So basically, most of our joint is synovial joints, which basically what that means is it's a capsule with some water fluid in there. And in the fluid, there's actually a little film that moves around. And it's kind of like when you put your hand inside water and you kind of flap around, there's kind of little bubbles that comes out.
Yeah.
That's what escapes your joint, and that's what the cracking noise is. A lot of people associate cracking with joint movement, and that's also false. Most of the time, it says 90% of the time when we adjust somebody, you will hear a crack, but that's not necessarily required for an adjustment to move. Because when the joint moves, we should the good chiropractors will feel the joint move underneath their hands, and that's why a lot of times when they say we want to go skin to skin. Now, obviously, because I've been in the field for over 20 years, we still could feel some joint movement. We could feel majority of the stuff underneath the shirts. So the cracking, no, it does not cause arthritis. It's basically just the air bubble trapped inside escaping the joints. A lot of times, people like to hear the cracks. People like to feel the cracks. Notice people who crack their neck, they keep doing it. Why do they keep doing it? Because it's addictive. When you crack something, it feels good.
Mentally, right?
The reason why it feels good is because there's actually endorphin release. Your body actually releases endorphin every time you crack something.
Oh, wow.
And that's why it feels good, because endorphins make us feel good.
Yeah.
I want to crack right now.
Yeah, a little cracks. It's always good.
I can never crack my neck. I don't know why.
Yeah, I've
never.
My wife used to crack her neck a lot. And once I got her adjusted, correctly, she could never crack it again.
Because of the releases, I guess, right?
Because actually the joints are now stacked on top of each other, and now there's nothing stuck, and she can't crack it anymore.
So that's basically the cracking is unadjusted.
It's basically stuck joints that when you move your neck and it cracks, and then when the cracking is basically the air bubble escaping out of the joints, and so you could crack every single joint that actually have synovial fluid in it. A lot of times, like with bulging discs, you actually won't hear a crack first few times. The reason behind that is the whole darn thing is swollen. Yeah. There's no air bubbles. We gotta get the swelling down, and then we could actually hear the crack. And I know, like, so many people want me to do this, and I was like, oh hell no, I'm never doing this. They want me to put a mic on the body while I adjust them, so they could hear the crack. Oh, they see we all seen those Instagrams where they crack so crazy. I don't do that. I was like, I'm busy enough. I'm good. I don't need to have
Because again, cracking is associated to something that you're doing.
I don't want people to keep associating cracking with the chiropractic adjustment, because there's a lot of chiropractors don't crack a joint at all, and they're great chiropractors. That's kind of misconception. I don't need to feed into that.
Yeah, and that's what we always talk about is the misinformation.
Yeah, exactly.
That people assume that's with the cracking, right? That's a myth.
Yeah, it is a big myth.
Yeah,
they've actually vetted you could crack your knuckles to your life content, and then you're good. But what they're coming from is the more we crack our knuckles, what we're doing is we're loosening up the ligaments around that joint. That's what causes arthritis.
Oh, I see.
Joint instability, not the cracking.
Okay.
So if you do it too often,
when you do it too often, then it's like too much of anything. It's bad for you.
Yeah. It's the excess of.
It's the excess.
Exactly.
When you have too much beef, you get high cholesterol.
Yeah.
Beef is not bad for you, but too much of it's really bad for you.
Yeah.
If you're all vegan, now you're lacking a lot of vitamins, and now that's bad for you too. But being a vegan should be the best thing for you, because it's a less stress on your body. But your body also needs some of the
bad vitamin.
Stuff. Right. I mean, if you look at our teeth are made to eat both.
Yeah.
It's not made to just,
We can chew everything.
Yep. I mean, look at cow. There's four stomachs. Why do they have four stomachs? And they eat their own shit? Am I allowed to say shit?
Yeah.
You could.
Oh, too late. But so the reason why they do that is so it actually goes to different stomachs to digest everything. And at the end of it, you get what we call cow. I'm from Texas, so we get cow chips, and you can actually use that as tinder for, firewood, and it doesn't smell because everything's dried up. Don't pick up the wet ones though.
The wet ones good smell.
So and so all the herbivores, they all have multiple stomachs to digest all this stuff. We as humans don't have that many stomachs. Last I checked, I have one stomach. I don't know about you two. I've seen you guys eat. At least I've seen him eat. Not you, but
we have external.
So we're supposed to eat mix. We're supposed to be omnivores. We eat both. Yeah. Now, too much of anything, as we said, is not good for you.
Of course.
So, even water. Drinking too much water is not good for you. But,
yeah. They said that if you drink too much water, you can actually drown yourself.
Yeah, you could actually you dilute everything because you don't have any electrolytes. Now you have muscle cramps and everything, and
can cause of death too. I think. Yeah, I was like looking at some of the
recommended amount is like a gallon a day or something like that.
My son was looking at it. I'm like, I learned a lot of things from his videos because he watches a lot of medical stuff.
What we want to say is, we always said the basic amount of water you want to drink is basically take your weight divided by 2, and that's how many ounces you want to drink. Now, that's on a basic, like if you don't drink coffee, you don't drink any sodas, you don't drink any alcohol or anything. It's just basic.
Just water.
Just water. And you're a regular, healthy human. Okay. Because we have to watch our pronouns, right? So...
You could be free with us.
And so, but then what I always tell people is, let's just say you drink a cup of coffee.
Yeah.
Who don't drink coffee? Then you want to drink 2 cups of that water. So if you use a regular mug to drink the coffee, after you drink the coffee, you want to drink 2 cups of water after that. Oh. Then start your...
To dilute the coffee or to
equal the water.
Oh, I see.
I drink way more coffee than I drink water.
Yeah.
So then that's kind of how you gauge how much water you want to drink. Now, if you're an athlete, that's a whole different story, because now I have to look into the sweat factor.
Yeah.
Of course.
So it just depends on who we're talking about. So I'm talking about regular average Joe.
That doesn't sweat.
Or Susan. Or Karen.
We don't like Karens.
Not here.
So, and that's kind of where we want to do. And that's another thing about chiropractic is, we not only look at the body's physical structures, we also look at the chemicals, which we learn how to read blood reports. We learn a lot about nutrition. We learn about supplementing. So we could actually give you a more global health care than just one thing. If you go see an ortho, they're very focused. Mm-hmm. You go see a nutritionist, they're very focused. You go see a naturopathic doctor, they're also very focused. But most chiropractors, if they go through the chiropractic program and they actually pay attention, that's a key word, if they actually pay attention in class, then they actually know a little bit about everything. And goes, okay, well, this is not working. This might be a nutritional issue. A lot with the ladies, I'm dealing with a lot about elderly ladies, so we have to look into the menopause. We have to look at that hormone imbalance. I'm finding out a lot of my female clients, they're actually hitting a lot of hormonal imbalance, either from diet or from just environmental. They're actually hitting their premenopause at an earlier age. Mm-hmm. So now we have to look into that factor, because when you hit premenopause, your hormones are dropping, your joint stability drops. That means you have to have the muscle to pick it up. We want them to do more weight-bearing exercises. We don't. Nowadays everybody's doing yoga and Pilates, and there's no weight-bearing on their joints. So now they get osteoporosis, osteopenia, and that leads to a whole different slew of things that we have to deal with. So that's another reason why I take x-rays, is because we don't want to go cracking on people that have brittle bones. Because guess who broke a rib before? First patient out of chiropractic school, 44-year-old lady.
That was like, ouch.
44-year-old lady. I just heard it was great crack. Great, wonderful. Next time she comes in, doc, I'm getting this pain on the side. Took x-rays, cracked 3 ribs. I'm so sorry.
You're like, who did this?
44-year-old. Who would expect her to have osteoporosis?
Oh, wow.
So guess what I do? I x-ray everybody now.
Yeah.
That's crazy.
Yeah, we see a lot of things.
That's the oops part of things.
That's the oops part. That's the oops. She was a nice lady, so she didn't. We didn't have any issues. We treated her for free, and we make sure that she was well taken care of, and she was very happy. But that was a lesson I learned very early in my chiropractic career, and that's why I take a lot of X-rays now. If you actually if any elderly that falls, guess what they're doing? They're taking a whole buttload of X-ray, because I want to protect myself. And so we're seeing a lot of chemical needs on patients that we need to address also, and not just their physical parts. So it's just I'm doing a little bit of everything now. When I graduate, all I want to do is adjust people. Now I'm doing a whole bunch of different things because the human body is just very, very complicated. We can't just look at one thing. If you have a kid, that's have scoliosis, that's something we treat a lot with kids. If they have scoliosis, which is with the curvature in your spine, if you don't tell the kid don't eat any sugar, it's just gonna be worse. If you don't have the nutritional part to back up what you're doing, you're just not gonna get the proper results. And that's just something that we need as a chiropractor, we're able to see. Some MDs are actually self-educating themselves, and they're doing better. But in a ballpark, now we are generalizing here, obviously, and for chiropractic, our education, because we can't prescribe drugs unless you're in New Mexico. New Mexico chiropractors can prescribe class 1 drugs, so they could give painkillers and stuff. But in California, in the state of California, we cannot prescribe drugs. So we have to look at alternative to drugs. So we look at, supplementing, we look at, icing, we look at, nowadays, a lot I do cryo. I actually saw, my wife actually sent me this, I think it was Instagram, a video of local cryo. They actually spray local cryo on different joints to actually help with it. I was like, that's actually pretty cool. So we're using a lot of that. And so chiropractic, it's a good medium to start out with. And if, it's a good chiropractor, they'll go, okay, this is something we can't handle. That's refer out. That's work with nutrition. And that's work with some nutritional supplementing. That's work with dieting. That's work with exercise. Try to get you to optimal health. That's kind of a little bit more in line with what we like to do.
I mean, it's a lot of people don't realize that there's a lot of things goes behind the scenes, and a lot more than just cracking bones, right? Like how we learned today. I mean, I was like having a few things about like chiropractors, doctors, like we kind of associate to our program where it's like money and wealth, right? Or, but your health is one of the most important tools in being able to do things by having that health, right? That having that, if your back is broken, painful, your muscles are tense, how are you going to be working? What are you going to, it's one of the hardest things that connects your wealth also. And what they say, health is wealth, because you can have so much money, but if you can't stand up to do anything, how can you, how are you able to go to work?
Steve Jobs actually had a video about that.
Yeah.
It's like he's got all this money, but when he found out he's got cancer, it's like, what good is money?
Yeah.
Exactly.
If you don't have wealth, you don't have your health, you can't spend your money.
Yep.
So
you can have the best doctor, but if you're not healthy, I mean, imagine him.
Yeah.
He had cancer. He could have bought what? I mean, he could have bought any medication, any device, any doctor he wanted to. But at the end of the day, that kind of still cannot save you.
Yep.
Exactly.
I like, when I was in Taiwan, I worked with a lot of wealthy people. And I was like, dude, you work 80 hours a week and you make all this money. Yeah, but your body's like in a shamble. The extra money you make, you're just giving it to me.
Yeah.
Why don't you just cut down your hours, chill, relax a little bit, let your body heal.
Mm-hmm.
Then you maybe save some money here and you actually end up with the same amount of money. He actually took my advice. He was like, Doc, you're right. I feel better. I spend more time with the family.
Yeah.
But my net's still the same because I'm not spending money trying to heal myself.
Exactly.
Yeah.
On energy drinks and, doctors and
it's like the
doctor's
football players, right?
Right.
They play, let's say, 5 years, 6 years. They get all these injuries. They make the money. But when they get out, they end up spending a lot of money on what? On their health care, because they can't stand up straight. Like one of those, they go through this Hall of Fame.
Yeah.
You look all those guys in the Hall of Fame, the way they're walking at 60, at 65, it's like
they're hobbling.
It's 150-year-olds walking,
Yeah.
like literally, because they have broken legs, broken ribs, broken arms, almost all their parts.
Yeah, I do have a few ex NFL players that come see me. Obviously, we're not going to say who.
Yeah.
And they all have issues. And why do they come see me? Because they have residual injuries.
Yeah.
I have a retired NBA player. He says, he was smart. He was he made his money. He got his ring, and he quit at his prime.
Yeah.
Because I am not going to put my body through all this crap. And then just end up having to suffer the rest of my life.
And not enjoy the money that you made.
So, yeah. So he took his money, did something else with it. And now he's back in the NBA, but he's not playing. He's coaching. So.
Yeah.
But
no injuries there.
No injuries there. He just yell at people.
Or maybe they might hit you. Or
they might. The new cats.
After our activities.
Yeah. So, but yeah. So he was one of the smarter ones. We're beginning to see a lot of that in football now.
Yeah.
A lot of football players are doing early retirement. I've made my money. I've achieved my goals. Now I'm out.
Or they don't do stupid things. They come in and play like
their fingers.
2 years. Yeah, they go 2 years of like doing everything. And then after 2 years, they get their contracts.
Yeah.
And and then you look at it, they're like superstars. They play, like, a lot of the football players, when they're like rookies, you look at their game, they're like amazing. They're doing all this stuff. Their running game is good. Let's say, or their best receiver. They get that big contract. And they're like, why am I going to play anymore? I have my contract. I have 5 years. Let them get rid of me in 5 years. I'm not going to take the hits that I was getting.
Yeah.
Why would you? I mean, once you get the money, you're hitting yourself against the wall to make the money. Yep. And then later on, why are you going to run against it anyway? You're like, hey.
Yeah, we're seeing a lot of that. We are seeing a lot of that. And that's what I'm saying. No, don't give him the big contract.
Give it to us. They should just pay us for watching,
But that's a sad thing. That really, honestly, that the biggest thing, the saddest thing I'm seeing with a lot of the pro, it doesn't matter if it's football, if it's basketball. It's, your biggest asset is your players.
Mm-hmm.
But the least paid people are the medical staff.
Mm.
I don't care if you're an athletic trainer or PT, an MD or DC. They're getting not big paychecks. But they're the one that keeps your people healthy.
Yeah.
Yeah.
So they should be paid decent. But they don't. And it's crazy.
You know what they say, the harder you work, the less you make.
That's about right.
You're doing most of the things that they're able to do beyond the field, crazy. Which is like the key. If they're injured,
I mean, if I have a football team, I would go out and grab the best chiros, the best the PTs, and to keep my people healthy.
Yeah.
Because if I keep my assets healthy, then I could actually make more money.
Exactly.
But they don't.
They still.
So it's kind of bummed. It's like the average pay. I mean, even the average pay of you would think that the medical staff in the Olympic teams, like the best paid people, they're the worst paid people. And I'm like, that's why most anybody that actually like a team chiropractor, a team whatever, they all have another clinic because they can't sustain life just doing that one thing.
You know what Joe Rogan was saying about that on his show? He said, he was talking about the Olympics. He's like, it's a scam. Because all these players paying money to go to the Olympics out of their own pockets, right? And the Olympics, they're making what? Like endorsements from Americans.
Isn't it in the billions?
Billions of dollars. That's like television, right? You have all the advertisers and so on. And the players don't get money unless you win a medal. But most of the other players, they spend the money going to it, right? And they don't even get. He's like, they should pay the players to be there, regardless of who they, because they're not like big players, right? I mean, like not like Americans where they have, like let's say for example, they have NBA players, right, or the pros go. But other countries, it's not it's their national team that is just regular Joes.
And that's why I'm really, really happy FICS, which is the International Chiropractic Sports Chiropractic. I do believe this is the first Olympic they actually was able to get into the Olympic Village, with the neutral team where all Olympians have access to chiropractic care. Huge accomplishment.
Yeah,
it doesn't matter if you're from Ethiopia. It doesn't matter from USA. It doesn't matter from Canada. It doesn't matter your nationality. You have access to chiropractic care.
But the teams don't have their own? Let's say, for example, if it's Team USA or like...
So Team USA, we fortunately for us, we do have our own chiropractors. Team USA, we're a little bit, we're a little bit different. Yeah. Like the fencing team have their own, they hired their own chiropractor. They have a chiropractor that follows them throughout the year. She's actually a really good friend of mine. Gymnastics have their own. But obviously basketball, they bring their own. Okay. But there's also a Team USA Olympic group, a medical staff group that travels with them, and they have all the U.S. Olympians have access to them. Now there's countries that does not have access to a chiropractor. That's what FICS comes in. Like Taiwan doesn't have one. Okay, they don't have a chiropractor that travels with team. Well, they travel under Chinese Taipei. Political. We're not going to get into that. I think China does not have one. Japan, I do believe, may have one. Malaysia have it. So there's a lot of smaller countries that does not have it. They have access to them. Today, actually, I was watching South Korea versus China. They call it table tennis, but we know it as ping pong.
Yeah.
And I saw dynamic taping on it. I was like, I know who taped that one. That's actually one of the FICS people that taped that. Because
the advancement of those tapes, it's just, sometimes I look at it, I'm like, what the hell? It's just a tape, right? It's just like,
it's great. I mean, I use all kinds of different tapings, so it's perfect. It's
Scotch
tape.
Like
I said, Scotch tape actually works sometimes. But I have one football player that dislocated her shoulder during the game, and it wouldn't stay in because she basically tore all her rotator cuff. And I actually used that tape to actually tape it all together so she could actually go home and get it fixed.
Just to keep it in place.
Just to keep it in place.
You know what's crazy is, with him, not like he's crazy, but with
a little bit.
So like, where COVID happened, right? And I want to a little bit talk about that experience, which is kind of, this is like at the, when they locked down everything, and he was actually with, I think you were with the U.S. team, right?
Yeah,
the
I was actually in Honduras.
So they got stuck in Honduras, right?
Yeah, while COVID is happening.
Yeah, and this is like, COVID was March
2020.
19 they closed, or 18 they were closing in some countries, or 16. March 16, I think they closed everything down. Somewhere in that range. And he was like there returning on March 18 or 19, somewhere in that range. And they like literally shut down everything. He was stuck. He texted me.
Yeah.
He was like, can you find somebody? Like,
I was texting everybody. We're supposed to leave Monday morning. And the president of Honduras shut down all ports in or out of Honduras Sunday night.
Wow.
And they told us it was all fine before we got there. But our tournament actually got cut short. And then I was like, okay, cool. We'll just hang out. And then, had a good time. And then okay, Sunday, we're going to, do our last hoorah. And then Monday morning we fly out. Sunday night, we watch on the TV. The president of Honduras came up because we're shutting down all ports. I'm like, fudge. This is going to be a long conversation with my wife. Because my wife warned me about this before we left.
Oh, wow.
And so I called my wife. We're stuck. I told you. This is when the wife said, I told you so, And so we're stuck there for a week. And actually, Trump saw us on Fox News saying that we're stuck there. And they flew like 2 military planes to pick us all up and fly us home.
It was just crazy.
A special guy next to us.
It's just a lot of a lot of crazy things, like I went through. So
it's been a ride.
Yeah, it's just like a lot of the work that you guys do, and the reason why I bring a lot of the experiences because I did experience. I'm like advertising for you, I need some commissions here, but the thing is, it is one of the most important things, I think this physical part of your body. I think we kind of mistreat our bodies. You know, what I want to know is, like, for example, is it mostly like muscle, like protecting you? Obviously, when you're getting older, you're losing muscles. That's where one of the keys to the pains come in, right? As far as the bones, what do you think?
Well, it's kind of the chicken or the egg question, you know. Is it the muscle that pulls? Like, if you talk to a PT, they're going to say, yeah, the muscle pulls the joint out of place. Talk to a chiropractor, no, the joints actually pull the muscles out of place. Mm-hmm. So which one is it? Because the muscles are actually attached to the joints. That's why you get the liver systems. So which one goes broken first? The answer is we don't know. Okay. We don't know which one goes first. Mm-hmm. But what we do understand is biomechanical failures. The body goes array when you're biomechanically unsound. And that comes from poor posture, comes from poor positioning. It comes from, if you're a athlete, poor form. If you're a chiropractor, if they didn't teach you the proper way to adjust, poor form. Okay, it starts from that, and everything starts rolling downhills. So we can't really say, is it the muscle that actually causes it, or the joint that causes it, or a chemical, the organs that causes it. It's a combination of everything, but it's a failure in your biomechanical functions. Then everything falls along with it. How did that happen? You know, it could be from as easy as picking, bending over and picking up a box, to a car accident. You know, one thing that we do a lot is what we call craniofacial release. My old business partner, he's now retired. He's a chiropractor. Also, he developed he founded a technique called craniofacial release, where we use balloons going to your nose. Mm-hmm. It's an endonasal therapy, not to confuse it with sinuplasty, which is surgical. But we go into the nose, and when you open up the nasal passages, we shift them. We kind of do some cranial bone shifting, and it's very, very minute shiftings. But that minute shifting and allowing the cranial bones to breathe actually changes a lot of physiological stuff. What it changes, we don't know. If I have the money and the time, I would love to do a whole bunch of research on it. But no money, no time.
Yeah.
But what it does help is, people with breathing issues. It helps people with allergies, asthmas. It helps them alleviate their symptoms and get them feel better. Concussion is one of the big things we do. We can't get rid of the concussion, but it actually helps us get through the concussion protocol a little faster, allows the brain to heal a little bit more. Is it more oxygen to the brain, or actually taking pressure off the sutures that allows the brain to heal? We don't know. But it does help. That's something else that we do. We're seeing a lot of patients with sleep apnea. We're seeing a lot of patients with breathing issues. We're seeing patients with allergies and brain fog. And so that's something else that we do as a chiropractor. Not all chiropractors are certified in that, but we do a certification with craniofacial release, and that actually helps with a lot of what the brain, which is kind of like 80% of our nervous system. So that's also something else we do.
How often would you say is the recommended amount somebody should go to a chiropractor for? It could be for an adjustment, or for, let's say, for an MRI or an X-ray.
So we always like to start out and then get in full spine X-ray, see what's wrong with you. Then we'll actually see what you need. But I always tell people, you go see a dentist every 6 months to clean your teeth, to maintain your teeth. What do you do for your spine? Nobody have a protocol to say, oh yeah, I go to my chiropractor once a month just to make sure I'm well aligned. Nobody does that. Yet our spine actually houses our most important organ, which is the central nervous system.
Yeah.
But we don't take care of it. We just kind of like ignore it because it doesn't hurt. There's no education out there saying, okay, we need to actually take care of our spine. Nobody educates that. But chiropractors, that's what we try to do. We always like to say, if you're not healthy and you don't have much issues, got a little aches and pain here and there, we like to see a chiropractor once a month. And if you're younger, you can actually get away with once every other month. but you always want to go. And sometimes I'll have a patient come and go, oh, yeah, pretty good, and I'll see you in about 5 weeks. I'll see you in about 6 weeks. So and if you don't need adjustment, I'll say you don't need it. We're good. I'm not going to charge you today. Get out of here. I'll see you in a month. So but in a general sense, because of our lifestyle these days, we're always in a rush. We're always driving. We love LA traffic, right? Everybody loves it. Of course. Because of the amount of stress we have here, I would recommend at least once a month go see a chiropractor. Get adjusted, make sure you're aligned.
Yeah.
And you actually live a more fruitful life.
That's why I only walk to work. I don't take any cars.
I thought you were using your bike.
Yeah, I do bike too. But it's the distance is
depends on how far.
It's like 5 steps.
Yeah,
I go from my house to the garage. That's
great.
That's my walk to work. That's my daily walk.
That's what I used to do. That's what I used to have at my clinic in Taiwan. Half of it used to be in my house. So I just wake up, roll out of bed, and go to the other room.
I don't drive. That's my traffic. But usually what I did was when I was every office that I did open, I used to do it very close to my house because I hate the driving. Like a lot of people will be like, oh, this area, and then they'll open an office thinking like, okay, what, I make more money at this office in that location, but then they don't counter the drive, the amount of time you lose, the amount of pain like especially California. I mean, LA, 5 miles can be 45 minutes.
Yeah.
Or like 30 minutes for 3 miles. It should take like 5 minutes or 3 minutes.
LA traffic is just.
Yeah, I live close to Universal Studio, and so coming to Burbank, it takes me about 10 minutes, 15 minutes. But then going from my Burbank office to my West Hollywood office, it's not that far. It's about 5-6 miles, but it takes me about 45 minutes because I have to hike over that hill.
Yeah. Taking the streets down and.
Yep. And once you hit LA.
But everywhere you see they're doing new construction and they're building new freeways, but those freeways are never ending. Them building that new freeways is never ending.
It's like Wilshire, right? Yeah. Wilshire Boulevard has always been, as much as I've been in this country, I've never seen Wilshire without construction.
How about the 5 freeway?
The 5 too. It's always construction. And you don't see any results. It's just.
On the 5 they did a little bit of a change.
It just. I don't get it.
Look at 405 though. Look at like when I moved to LA, 405 was 8 lane. 4 on each side.
Yeah.
Now it's 16 lanes. There's 8 on each side.
Yeah.
And it's still stuck.
Yeah, I think the 405 is one of the busiest freeways in the country, if not the world. More cars pass through that.
Crazy.
Yeah, because I think it connects to a lot of, it goes through a lot of patching.
405
because
connects
101
to the 405, to the 5, to the 10.
All the way to Long Beach.
Yeah. 710, 610.
Yeah, it's that's why we have that's why, a lot of people don't go to the most important things that we do. That could be, let's say, when in our business, the insurance, like people don't get the life because it's not mandatory, it's not seen, it's not sexy, right? Or it doesn't cause them pain, right? Because it's not forced. Like same thing with our teeth, we go more often because we feel the pain. You can't just sit there and say, you know what, I'm not gonna go. It's gonna kill you. So you go. With the back pain, you do it and it goes away. You're like, okay, you know what, I'm good. I'm not gonna go spend money.
Exactly.
You know what I mean? It's like, and then when you get older, we have a lot of guys in our lodge, and like people are younger. Like I'm talking about 35, like you guys too. They have so much back pain. They call us and we're like, oh, we're not coming because I can't move. And like 30 years old, 35, you should not have.
You shouldn't, but
you know what I mean.
Nowadays, the nutrition. I always tell people, because I'm older, like when we're young, you eat a cabbage, it's actually sweet. Now you eat a cabbage, I don't know what the hell you're eating.
Yeah.
It's just like.
No matter if it's organic or
no matter if it's organic or not, there's no nutrition in it.
How do you feel about stem cell injections?
That's the future.
That is the future
of medicine. what's what we call regenerative therapy, stem cells, PRP. These stuff are actually really, really good. The unfortunate part is only the stem cell only work if it's umbilical stem cell.
Yeah.
And umbilical stem cells are partially differentiated.
That's
So
when you're a baby, they get the
baby, the
umbilical cord.
Yeah.
Yep.
And that's what we did with
Yep.
my kid.
Yep.
You know, when he was born, we every month not month, but every year we're paying, I don't know how much.
So
to save
that's
that.
the most viable part. And nowadays we do have genetically engineered stem cells, and they work sometimes.
Can they take it from somebody else and then kind of inject it in you, or does it-
So the most part they take it from you. You know, there's a lot of ways you could do stem cells. Some they take it from your bone. Some they take it from your fat. You know, like I have a lot of friends that says, "Oh, take all my fat and then give me the
so
stem
it's
cell."
good, so grow it.
So, and they'll take it from your body part. It just depends on what they're doing and which parts they're injecting. So there's a lot of ways to get stem cells.
So it's an advantage getting fat.
Kind of, I guess.
If you're because I've heard a lot of athletes.
Based on his thing, he said, listen, if you're fat, you can drink more water. So if you're fat, you can have, more benefits of stem cells.
And this is the problem with the country today. Take something and just screw it all
I'm
up.
just positive. I take all the positive stuff that comes with all the negative things.
All the positive stuff for you.
Make the bad stuff, make it positive.
But yeah, so stem cells does work. And it actually works better with PRP. So PRP is basically you taking your blood, you're centrifuging it, and you're taking that yellow part, the plasma part, and you're adding stem cells to it and injecting into your own body. That works the best. And I work with a lot of clinics that does that. If I get to do it all over, I'll probably go. And if I was like 10 years younger, I'll go get my nurse practitioner degree, and I'll do that because it makes money faster.
Yeah.
And it actually really, really works.
Do they do it on a clinical basis, or like, for example, you have to go to the hospital, or you can do it in a clinic?
If it's for if you're for extremities, so your shoulder, elbow, wrists, knees, ankles, you could do it at a clinic. The only times you need to go to hospitals is if you're going to work it on the spine, because they actually have a special equipment where they can actually see where they're injecting. You got to see where you're injecting.
Yeah.
Dr. Martina Randall in Burbank, she actually have one of those machines in her clinic that she could actually look at where she's putting the needle, and it's really, really good. She's one of my referrals for injection. For PRP injections.
Now they have that is the same thing. There's two. I don't know if it's two different things. When they, you have, let's say, back pains and spine pains and stuff, where they inject. Is there something else that they inject in there?
So first thing that I usually do is they do epidural injections. Those are painkillers pretty much, and that's different.
Does it last you like I think 6 months, or is it like something like that?
So those are just they just numb your pain. They don't do crap. They just numb your pain.
Doesn't
And
fix it.
The idea of getting epidural is not for you to get the epidural shot and go your merry way. The idea is to get epidural shot so you could do the physical therapy exercises so you could get better. But people, I got an epidural shot. I don't hurt anymore, so I'm going to go on my merry way and do stupid things again. But that's not the idea. The idea is, and that's why doctors tell you that you get your epidural, you go to PT. But because I get my epidural, I feel good. I'm not going to go to my PT.
That's what I was telling you. People don't feel the pain; they forget.
They forget.
You forget that you had that
And now
pain.
you damage the joint more. And now you're
making more money.
Now I'm trying to make more money.
It works out.
So it works out for the best for everybody, right?
Yeah.
So the regenerative therapy is the new age in medicine. Everybody's trying to do it. Even with cosmetics, they're doing PRP injection into the face to get rid of wrinkles. Yeah.
Or epidural. So if you get slapped, you don't feel it.
I guess you don't feel it. Exactly.
Like boxers do it. It's like you're getting punched. You're like, oh, what is that?
Yeah.
No, the reason why I asked about the stem cell injections is because I was reading an article or I was watching a video. I don't remember. An athlete broke their leg or they dislocated something. They did a stem cell injection. Within about a week, he was good to go again. week or a couple of weeks?
I won't. I don't think it's that fast, but it is a lot faster. A lot of times, what they do now with a lot of pro athlete surgeries, because they have to go back. So what they do is after surgery, they actually do PRP injections with stem cells in it, and that's from their own stem cells, and they'll put it in that area to promote healing faster.
Interesting.
One other question that I have on that, let's say, for example, the difference between yourself and the umbilical cord. How do they use that? And is there, let's say, for example, they keep a certain percentage of that, and then what is the offset of it?
I actually have a chiropractic friend that actually does all this stuff, and he would know more about it. But from my understanding is they could take the umbilical cord stem cell and they could grow it. And when they grow it, then one umbilical cord could actually use for 20 people. I think that's what.
Oh, so it's not like a one-time use.
It's not one-time use, and then so they can actually differentiate, and they actually and that's why the labs and how clean it is comes in handy. Pharmaceuticals, our favorite best friend. They're able to do genetically modify stem cells, where they use viruses to split them and then use that as a base to become stem cells. That's another way. So there's a lot of different. So you kind of have to look at, ask the doctor what's the source of your stem cell and where's it coming from, and then you get a good idea of how good the stem cell is, and. For a lot of damaged stuff, they actually use umbilical stem cells mostly. And then if it's just like post-surgical or minor stuff, then they'll use your own stem cell.
Mm-hmm. I mean, that's pretty much, I think we covered almost everything there.
Sure did.
How do they find you? Where they can go find you and contact you and... you want to share that?
I'm low key. You kind of have to know somebody, know the secret knock and everything. No, I'm kidding. Well, obviously, our website www.dnasm.com. Where and if you're not afraid of Yelp and Google, you can always Yelp and Google me, and all the evil stuff that they say about me is all true. No, I'm kidding.
I attest to that.
So I'm pretty easy to find. Most times, our website's pretty easy to find. DNASM.com. As I said, I'm in Burbank, LA, and Arcadia.
So they can catch you almost
everywhere
in between all the cities.
In most of the city. Before I used to have one in Woodland Hills, but like you said, it's just too far to drive out.
Yeah, I used to come to that one. I got one time I came with my mom, parked like 5 minutes in front of the thing. They told my car.
It's crazy.
If you guys guys don't see me on the next episode, you guys know where I'm at.
Where are you going? Oh,
I killed him.
I
need to, man. I need to get rid of this.
Can I pay you extra?
To keep me there?
No, it just kind of breaks up.
Oops. A couple of ribs here and there.
Oops.
3 oopses. So if you don't treat me well, if you're going to,
When do I not treat you well?
I know, I'm just kidding. No, that's that. That's. You have any other questions?
That's it for me.
Yeah. So I think we pretty much covered it. Do you have anything else that you want to add before we go?
Well, if you like to have a good time and enjoy a crazy chiropractor, you're more than welcome to see me. We are not very, very strict in our clinics. We crack a lot of crazy jokes. And we have a good time. We like to, most patients actually don't call me doctor. Most of them just call me Chris. I'm cool with it. We always like to I always tell people, what the people ask me what the DNA stands for. I always tell them, do not adjust. I joke around with that, but it is true. It's like a proper chiropractor actually knows when to adjust and when not to adjust.
Exactly.
And so I think I want to leave with that is, whenever you see a chiropractor, if they just want to go in and crack everything, that's probably not a good thing. Because there's time to adjust and there are times not to adjust, and if they don't know the difference, then I want like one of my teachers said, I want to let them see my dog.
Exactly. I mean, thank you for taking the time.
You're welcome. Thank
Coming
you for having
here.
me. It's my first podcast.
Yeah.
Kind of cool.
This is kind of for us. Everybody that we bring in, we get educated too. You know.
Of course.
And I think we learn a lot of things, and hope that we give those knowledge to our viewers as well. You know, that's one of the keys that we do. And hopefully, you know, we'll have you more and more with us, and hopefully people will take something from what we talk about. I know we got a lot of information.
Absolutely.
For free of charge.
Well,
and I always tell our viewers that, you know, we don't get paid for bringing people in. We don't pay people to come in. So the advice that we give is just organic advice, where we're not just selling something. We don't want to sell anything. We're not selling anything. Even our other podcasts that we do with our own industry, we don't want to sell. We want to give information. And if people want to do anything, you know, obviously we're going to have your name underneath the screen. We're going to, you know, if they want to reach out, they want to do anything, you guys can reach out to him and get assistance. And I mean, from my experience, Chris, you know, I mean, from all the people that I've referred, they all got a benefit. You know, there's no one that said, hey, you know, oh, I went to him and oops, you know. So
not very many.
Yeah. So, you know, they all like it.
I'm working on that.
So that's one of the things, you know, and I always, you know, we bring people in that actually bring value, you know, and I'm 100% sure that we did. And they will get something out of it, and I want to thank you for that. But other than that, you know, hopefully you guys will follow us on all the, you know, Instagrams. Everything is on the screens, and hope we can see you guys next time. Thank you, and have a great.
Thank you for having me. I hope to come back soon.
Thank you for coming by.